Hello, and welcome to our HIV 101 webinar series. This is HIV 101, Prevention with Positives. My name is Stefan Perez, and I'm an HIV clinical specialist with Health HIV and the AIDS Education and Training Center, National Center for HIV Care in Minority Communities. In today's webinar, we'll be discussing prevention messages and education for people living with HIV. Specifically, we're going to be discussing these learning objectives. First, we're going to define what exactly is prevention with positives and what does that mean in the clinical setting. Then we'll discuss the use of prevention with positives in the clinical setting in order to help reduce HIV transmission. We'll also talk a little bit about conducting assessments of high-risk behaviors in people living with HIV and how to provide prevention with positive messaging. And lastly, we'll discuss some specifics around HIV transmission as it pertains to patient education. So, what is prevention with positives? Well, it's a strategy for educating people living with HIV to ultimately decrease HIV transmission. Included in prevention with positives is practicing safer sexual practices to reduce the transmission, enhancing strategies for keeping patients living with HIV protected from sexually transmitted infections, and using harm reduction strategies to decrease the risk of transmitting HIV and or acquiring other infections associated with high-risk behaviors, including intravenous drug use. Taking responsibility for preventing HIV transmission is an important concern for most people with HIV, as well as for their healthcare providers. Studies have shown that about 1/3 to 1/4 of HIV medical providers do not ask their patients about sexual behavior or drug use. However, many HIV-infected individuals report that they want to discuss prevention with their healthcare providers. So each patient visit presents an opportunity to provide effective prevention interventions, even in those very busy clinical settings. A few key pearls of prevention with positives include information cannot always change behavior. And what do I mean by that? Well, you can't always tell somebody that eating an ice cream sundae isn't necessarily the best course of action for their diabetes. But just telling them that information doesn't always change their behavior. And I think all of us are very familiar with that who work with patients on a daily basis. Another thing to remember is that harm reduction principles are very important. Assessing where the patient is on the continuum of HIV risk transmission and high-risk behavior is very important to try to target harm reduction interventions. Be prepared to talk about sex and drug use with your patients. It's very important to try to establish a rapport. Now, remember that it's not always possible to establish a rapport with every single patient. Not every single provider is going to be able to have this kind of a rapport with every single patient. So if you're finding it difficult to connect with your patient and build a relationship where they feel comfortable talking about sex and drug use at the visit, it might be necessary to bring in another clinician or another provider at the site as time allows. Perhaps a nurse case manager, perhaps a social worker, or a health educator that you might have access to. Engaging the interdisciplinary team is going to be key. It's really important also to establish a baseline of prevention knowledge. So what does the patient know about HIV infection? What do they know about transmission? And then it's really important to discuss and reinforce this at each and every visit. So, in practicing prevention with positives, assessment is going to be key. Assessment should include sexual practices, including partners, condom use, number of partners, gender of partners, HIV status of those partners, insertive and receptive practices, any treatment history in those partners around sexually transmitted infections. Also important to assess the patient's knowledge of HIV and transmission, which we spoke about a little bit earlier. Talk about disclosure to partners or persons who are at risk for infection. Very, very key to assess drug and alcohol use, including current use, past use, type of substances, frequency, any injection practices that they might have, and then of course association with sexual activity. As we know, drug and alcohol use can lower a patient's inhibitions and they can engage in much higher risk sexual activity. Very important also to conduct pregnancy screening, and then always assess the patient's antiretroviral therapy and their current viral load. It's really important during your assessment to allow the patient to guide the discussion as much as possible, starting with the patient's current knowledge and practice. Always address any presenting concerns. Anytime a patient brings in a concern or a presenting question to the healthcare provider, especially around prevention, this is a key opportunity. They're opening the door for us to begin to have those discussions with them. So that's key. And then the provider should always ask open-ended questions, and of course in a non-judgmental manner. And this is something that we do every day, but it's really, really important in terms of prevention with positives. And then it's also important to recognize that not every patient seeks the complete elimination of risk, for instance, abstinence, but rather the reduction of risk to keep their partner safe and keep themselves safe. So choose options that are appropriate for the patient, of course, in consultation with the provider. Some more key interventions are education of the patient around transmission, especially to correct any type of misinformation that may occur, and we'll talk a little bit about this in a few moments. But we've all had patients who come in with a lot of incorrect information around any disease process, but in particular HIV. It is a highly stigmatized disease, and I've had grandparents come in and say, it breaks my heart when they say, I haven't hugged my granddaughter in 2 months because I'm afraid that I might give them HIV. So it's really important to correct any of that misinformation early on, and then empower the patient to correct misinformation among their loved ones or among people in their lives as well. Try to prioritize behaviors that a patient is engaging in on the risk continuum, and we'll talk a little bit about that in the coming slides. What are the patient's risk behaviors? What are some of the riskier behaviors that they're engaging in? And again, harm reduction is going to be very important and key to those interventions. Always important to supply the patient with condoms and lubricant if possible. If it's not possible, then it's important to provide community resources where these patients can access this at a very low cost or for free. And then if the patient is unwilling to use condoms, counsel them around how to reduce their risk, including screening and treating sexually transmitted infections, using lubrication and condoms, avoiding drug use, and then again using harm reduction principles to choose less risky sexual activities. Some further key interventions include screening for STIs, delivering messages tailored to the patient's readiness, which again is harm reduction. So those basic principles around, well, I can't get you to stop engaging in this behavior, but I'm going to keep you as safe as I can while you do it, and that's the basics of harm reduction. Causing least harm to the patient, knowing the behaviors that they're going to engage in. And then we want to promote antiretroviral adherence. As all of you know, there's been a lot of activity around this in recent months, around the knowledge that undetectable viral load is correlated with a much lower risk of transmitting HIV. And then acknowledgement of the practice of serosorting. And this is a practice that does happen out in the community, and it's when HIV-positive patients only have sex with other HIV-positive individuals. It is effective in preventing transmission to uninfected persons. However, if patients or if people are having unprotected sex with each other, I tell my HIV-positive patients that if you're having unprotected sex with another HIV-positive patient, that partner is probably also having unprotected sex with another HIV-positive patient or another person, excuse me. And so I try to come at serosorting from the idea that you want to protect your partner, but you also want to protect yourself, and so you want to try to use condoms if possible to just reduce the risk of sexually transmitted infections. So a lot of providers ask me, okay, well that's great, but I have 15 minutes with my patient and I have to address their HIV, their diabetes, their hypertension, their depression, and all of their primary care needs and primary care screening and health maintenance, and then I have to do my note and bill and code. So I understand the time constraints, but I think if we could just dedicate, a few minutes, as much as possible to try to do these key interventions. So again, using a risk assessment, trying to determine where the patient's risk behavior lies on the continuum, take a couple minutes or 1 minute to correct any misinformation that the patient may have, take one more minute to assess the patient's readiness, and that may be yeah, I want some more information about that, or no, I don't want any more information about that. Remember, those stages have changed. Again, screen and treat for STIs, so that medical intervention, and then supplying medications and condoms as needed. There's one compact prevention with positives intervention that you've just completed. So I do want to speak a little bit about some key interventions around intravenous drug use. Many of you may care for patients who are using intravenous drugs, so it is an important piece of prevention with positives. Again, you do want to follow the same principles around assessing for readiness, but in particular you want to assess for readiness for treatment. Not all patients come in the door ready to go into drug treatment, but I think it is important to try to assess it as often as possible around their treatment needs or desires. And then, of course, using sterile needles, giving them information around needle exchange, using new or disinfected cookers or works, making sure they know how to clean and inject safely, and then making sure that they know how to dispose properly of their syringes or any other works that they might be using. This is what I was speaking about earlier around HIV transmission and how it's really important to correct any misinformation that's out there. I do share this with my patients, that HIV can only be transmitted in blood, semen, vaginal secretions, and breast milk, and then the types of modes of transmission that do exist. I do find that it's very important for the patients to know that, and they often do want to know that. How it's not spread is by air or water, insects, saliva, tears, or sweat, casual contact, hugging or sharing dishes, and then casual or social kissing. This is also very important for patients to know, because then again it also empowers them to go out to their loved ones or to the people in their life and dispel some of those myths as well. I don't often share this graphic with patients. However, I do feel that this is important information for the provider to know, and I do use it when I'm counseling patients around HIV risk transmission. And I simply use it as a tool to say, injection drug use is a much higher risk than the other risk behaviors, and for instance, receptive oral intercourse or receptive anal intercourse is a higher risk activity than receptive oral intercourse. So I use this sort of risk continuum to talk with patients around decreasing their risk for transmission. And then this I included in here as a caveat for us providers and clinicians, because HIV transmission is a concern, obviously, in occupational exposures, and I do include this in here for our own knowledge around the different types of exposures that can happen, the different fluids and transmission categories that can happen, just so that we are all knowledgeable about this as well. Again, this is just a graphic around occupational post-exposure prophylaxis. I do recommend that if an post-exposure occupational exposure occurs, that you contact your administrative person at your site, and then also seek treatment through your occupational health or whatever you have in place for occupational exposure event at your site. these are a couple of resources that are available to clinicians at the National Clinicians Consultation Center. It is a warm line that provides clinical advice around HIV management, and there's also a PEP line that provides expert guidance and immediate post-exposure prophylaxis recommendations. So this is a very useful tool, particularly for HIV, hepatitis B and C exposures in healthcare workers. It's a very, very important, a very useful tool, a wonderful service that's available to all of us clinicians, or anybody working in the healthcare field who may have had an exposure, and they can get immediate advice over the phone around what to do and how to proceed. So that concludes our webinar around HIV 101 and prevention with positives. I'd like to thank you for participating today. As always, if you have any questions, you can reach me at 202-507-4740. You can also email me at stephen@healthhiv.org. Thank you very much.